we've got Kim Downs here, who is one of the directors of the Australian Pituitary Foundation, and actually also a patient who has had a craniotomy. And I'm very grateful to Kim for giving up her time and her experience to talk to us today about what a craniotomy means to her. We have a few questions from the Pituitary Foundation community, Kim, that we're going to pose to you regarding this.
Yeah, absolutely. Thanks, Ian, for inviting me to do this.
Okay. One of the first questions people always have with craniotomies is, were you scared? It's a scary procedure for most. We talk about making a cut in the on the scalp, lifting up a bone flap. So the first question is, were you scared?
The answer is yes, but it was kind of surreal for me. From the time of diagnosis was a Tuesday, surgery was on the Friday. So I really didn't have time to process what was happening until I was actually on the bed. They were wheeling me into surgery. And I went, whoa, hang on, you can't cut open my head. What's it going to be like then? So I didn't really have time to process it prior to surgery. But I had trust and faith and knew that this was my only option in this circumstance, to remove the tumor. So yes, was scared, but wasn't petrified, if that makes sense.
Yes. Bearing in mind you had a short period of time between the diagnosis and operation, if you had your time again, what questions would you have asked? And what would you have wanted to know prior to surgery to prepare you better?
Do you know, I think it was actually good that I didn't have a lot of time before surgery. So I didn't have a lot of time to think about it, overanalyze it, process it. But I think I would have not particularly wanted to know more about the surgery because that was gone through thoroughly. I would have wanted to know more what to expect after surgery and what was normal and what wasn't normal. So how long would the pain last? You know, what sort of things should I be able to expect to do after surgery and how long would that have taken? That's probably what I didn't ask and didn't expect. So, you know, maybe I should have asked, will there be any memory loss? I didn't have that, but that's a question that I think would have been normal. Would there be any changes in my personality? Would there be, you know, any changes physically of things that I was able to do or not do? So probably those would have been the questions for after the fact, rather than leading up to surgery. And I know that the more calm a patient is going into surgery, the better for what am I trying to say?
I mean, the recovery, and we know that outcomes are better often when patients are calmer and I guess mentally ready for the surgery.
Yeah, yeah.
From the recovery perspective, did you have a lot of pain post-operatively?
Right after surgery, 24 hours after, within the 24 hours after surgery, yes. Mainly throat, just because you're intubated, you know, you're put to sleep during surgery. The skull itself, no, I don't remember having a lot of pain. I don't remember having pain until the nerve endings started to refuse together. And then there was a lot of pain.
And pain at that point was in the skin itself. Is that what you're talking about? And how long after your surgery did you get this sensation?
To be honest, surgery was 7.5 years ago and I still get it. Mm-hmm. If I'm really tired, the skin around where the incision was made feels like it's pulling, or if I touch it, it's very sensitive. But I know the signs now, And probably the fusing of the nerve endings after surgery, well, I'd say it probably took a year for that sensitivity to go away.
Okay. One of the things I often tell patients having a craniotomy is that we have to detach one of the jaw muscles that comes down from the side of the head, the temple, down to the jaw. Some patients say there's a fair bit of discomfort and pain just opening and closing their mouth or chewing after surgery. Do you remember having any of those sensations?
I remember having a little bit and didn't remember that until you just said it now, but it wasn't anything significant.
How much hair did you actually have to have shaved off for your operation?
Yeah, I really wish my surgeon would have told me that beforehand. But it was all this section here. Um, and it grew back quite quickly, came back curly. And it was a bit of a shock after surgery, looking in the mirror and going, oh, okay, yeah, this actually did happen. But yeah, listen, it grows back. It's fine.
And the hair growth now is back to normal, or is it more thinned or whatnot?
No, it's absolutely normal.
Okay. A couple more questions we have here. The community have asked, what questions should you ask or watch out for in recovery? And I know you've touched on some of this already, but is there anything else specifically that you could talk about in terms of recovery?
Yeah, I think it was really good that I was told the sooner you could get up and walk, the quicker your recovery would be. I was anxious to get back and do things, but I think probably more needs to go into post-surgery. You know, you need to be in bed for X amount of weeks, or you need to rest, or not talk to people, or not have visitors, or not be going out, or not go back to work till this time. And everyone's going to recover um, at different paces. But yeah, I think it was important to really focus on individually what I was able to do, or how much I should push myself.
Do you remember in the first 6 weeks, what simple stuff like housework, driving, that sort of stuff, what were you able to do at that point?
I wasn't allowed to drive. I did go to the grocery store. I think it was about 3 weeks after surgery with my husband, and found that the lights were really affecting me in the grocery store, and probably got, 2 aisles in and went, I'm too tired, I have to go home. I would go for walks up and down the block or around the block, and that was okay. But I think maybe a combination of the lights and being inside and walking around, it just exhausted me. Yeah.
I think that's one of the big differences between having a craniotomy versus a transfenoidal surgery. From a technical perspective, a craniotomy means we enter the CSF or the brain fluid spaces, whereas usually with a transfenoidal transnasal surgery, we don't. So what you're describing is a bit of photophobia. It's a bit of meningism, what we call meningism. And usually that shouldn't happen with a transfenoidal surgery, but it does with a craniotomy. And as you said, individually, it can vary. Some people have meningism for a week. Some people have it for 6 to 8 weeks. And it can flare up out of nowhere. You may go along thinking for a few weeks, I've been perfectly fine, I've got no troubles at all. And then it just hits you and you're like, oh, I've got these symptoms, I've got fatigue, I can't do anything.
Yeah. 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 That's what I found is I would think I would be fine, even maybe 3 months after, okay, let's have some people over for dinner. And then just preparing that dinner, I was exhausted. Whereas before I would have been fine. But that goes away over time. It's just giving your body that time to rest and recover. And the scar healed really, really well. I think I was really nervous after surgery about getting the staples out, and, worried about, would it hurt? What's it going to, feel like, be like? And I didn't feel a thing. It was perfectly fine.
So do you recall how long did you end up staying in hospital for?
I was in the hospital for only 1 week. So actually a week and a day, because I went in on the Thursday for surgery on the Friday. and released the next Friday, and then was at home, a little bit of walking every day. Really didn't do any housework, had people coming over with meals, things like that. Great community spirit. It was lovely. But about 6 weeks later, I was back to working with my clients over the phone, and really could probably only do that for about 2 hours a day. Otherwise, I was really tired. But by the 3 months, pretty much back to doing everything.
One last question for you. Do you have any other tips for carers of how to look after someone who's had a craniotomy? Because they're obviously in a tough situation also.
My experience was interesting in that I had I have friends that are nurses, so they understood what I needed, what I shouldn't be doing, that sort of stuff, and they were fantastic. But people, just ordinary people, when you have your head shaved and you've got this big scar, they kind of looked at me like I was really fragile, and should have understood, no, I'm really strong. I just got through this, and I'm just fine. Tumor's gone, I'm fine. So a lot of people didn't know how to react to me, and my immediate family was really, really scared, really worried about what I should be doing, what I shouldn't be doing. And so I think it was almost harder on them than it was me, because I knew how I felt. I knew what I could do. I knew what I was up to, being able to do. But to them, it was, oh my God, what should we do for her? What should we expect? So I think for carers, it's just have that open communication. Ask questions of the surgeon, ask questions of the patient, ask questions of the nursing staff. And I don't know if there's a manual or a book for carers that could be given to them to say, this is what the person's just gone through. Here's the certain things to expect. That might be helpful.
All right. Thank you, Kim. One final issue that came up when Kim was sharing some photos with me at the end of our interview was the issue of eye swelling on the side where the craniotomy was done. For Kim, this was quite intense, and the right eye swelled completely shut for up to 4 days following surgery. The reason for this is when you cut the skin and elevate it, a lot of the skin gets swollen, but the swelling goes down with gravity towards the part of the face that has the loosest skin. And you can imagine your eyelid has the loosest skin at that region there. The eyelid will swell shut for roughly 2 to 4 days. It can be a little bit painful at that point, and so sometimes some eye patches, ice packs, or eye ointment is needed during that time period. Once the swelling settles down, everything goes back to normal, and there's no long-term sequelae from that. I just want to thank Kim one last time for giving of her time and experience, sharing her story and sharing some really quite personal photos of what she went through from having had a craniotomy all those years ago. Stay tuned, there'll be another video coming up with a neurosurgeon, Mr. James King, who will discuss the more technical aspects of a craniotomy from a surgeon's perspective, as opposed to having a transfemoral surgery.